Hello, my name is Annabelle Torres. Now I'm doing a presentation, a final team presentation on pediatric dental tooth decay. What is pediatric dental tooth decay? Overall, pediatric dental disease can lead to health issues. The pain and infections that are left untreated can affect the ability for the children to speak and eat. Historically, it has been known that tooth decay has led to heart disease, stroke, diabetes, and pneumonia. It is the number one chronic disease in children. It can impact the children's overall quality of life, inability to socialize with confidence, self-esteem issues, and overall mental stability. The American Academy of Pediatric Dentistry, this first ever State of Little Teeth report, underscores the significant threat that tooth decay has to the health, welfare, and future of children in the U.S. And while studies show that delaying the first dental exam until the age of 2 or 3 can have an adverse impact on a child's oral health, the State of Little Teeth report reveals that 40% of parents and caregivers surveyed wait to take their children to the dentist until after age 2. Improving oral hygiene for low-income families. Recent studies or surveys show that preschoolers' dental care has worsened. It's due to the inability to receive Medicaid, but there are Head Start programs, and there are 2 essential services of public health: CDC funding, fluoride, and community health. The state dental program synopsis provides population and demographics. There's a review of the problem and premises preventing a solution. A proposal that Head Start adopt a public health perspective and specific roles staff and dental personnel can take to mount aggressive strategies to arrest tooth decay at the grantee site. Policy development and actions. Pediatricians provide preventive dentistry services and referrals. School health nurses and tooth decay can be prevented. Passing bacteria by sharing utensils and foods, avoid sugary drinks and baby bottles with milk to fall asleep, and fluoride in water and bottled water. The objective: several healthcare organizations recommend that physicians provide preventive dentistry services, including dental screening and referral. This study is the first to investigate characteristics of medical providers that influence their referral to a dentist of children who are at risk for dental disease. The methods is a cross-sectional survey which was undertaken of primary care clinicians in 69 pediatric practices and 49 family medicine practices who are enrolled in a study to evaluate a pediatric preventive dentistry program targeted toward Medicaid-eligible children in North Carolina. A 100-item self-administered questionnaire with 23 items on some aspect of dental referral elicited providers' knowledge and opinions toward oral health, the provision of dental services, and their confidence in providing these services. Tooth decay is largely preventive or preventable, but it remains one of the most common diseases of childhood, 5 times as common as asthma and 7 times as common as hay fever. According to the Centers for Disease Control and Prevention, the CDC says 42% of children ages 2 to 11 have had cavities in baby teeth. 20% of those ages 6 to 11 have had cavities in permanent teeth. An education campaign by the American Academy of Pediatric Dentistry highlights the seriousness of dental decay in kids and urges parents to start early to prevent it. Existing policies. There are fluoridation in New York State, and what they've done is added to the community some drinking water. It provides oral dental insurance care for people that are lacking, and it also provides more specialized pediatric dentists for children that have severe dental issues. Strategies to promote education and preventive tooth decay. How do you prevent tooth decay? Risks are high for getting tooth decay if not treated. It promotes partnership by working with small organizations to help families that do not have access to oral insurance. American Dental Association interim guidance on fluoride intake for infants and young children. And there are also state and local dental public health programs. As there are 10 essential public health services. In early assessments, the child's first set of 20 teeth, called primary or baby teeth, usually erupt from 6 months to 3 years of age. These primary teeth are gradually replaced with 32 adult or permanent teeth that commonly erupt between 6 and 21 years. Primary teeth are as important as permanent teeth because they allow children to bite and chew food. They are crucial for proper speech development and also aid in the development of the facial bones and muscles, and hold space for the permanent teeth and help guide them into position. The management and prevention. Parents must take into consideration that certain foods and drinks could enhance tooth decay. It is important for the toothpaste to have fluoride and to not be sent to bed without brushing their teeth. And one way to inform the public are that schools, including daycare facilities, are promoting free dental screenings and observance from the teachers. The more educational discussions and documents are being sent home to the parents, the better off the parents would understand the consequences of tooth decay. Resolving the issue. If the child has a cavity, it is recommended to have the cavity removed by the dentist and have it filled immediately. There are new types of technologies to cover good teeth from getting future cavities. With the policies can be enforced through pamphlets that are sent home again with children, and even after the birth of a newborn baby. The more advanced that a parent has an understanding and being educated of tooth decay, the better off the parent would be. You can enforce the laws and by having dental insurance provide at least 1 to 2 free annual cleanings. And there are a lot of government programs or laws that are able to enforce those type of opportunities. You must be sure that the public has the opportunity to request for assistance from local and state services, and this way they'll be able to have the routine dental checkups, and it's critical for proper speech development. And also, you got to make sure that qualified and certified dental facilities are being used to be able to treat these children. You have to be able to evaluate and research the results, and you must be able to continue to focus on prevention and control of early tooth decay.